Abona online apaho SIMA insia. Abona online apaho de na SIMA health show mre na Akosua ye bro e wo Kantanka TV. SIMA health show ye show bi Kantanka TV ahihye se bebo Ghana fo nyina apomuden. Senyan kupon aboa ma wo nkwamu dia na e wo se won so bo homoden e bo apomuden ho eban. Kantanka TV ahihye dwumedie e de bebo Ghana fo nyina ene Ghana ni bia. Bebia wo bia frobi na obi nso frobi. Ye streaming live on Facebook. Odofo bi ni fie na opese o hwe SIMA health show yi bia. Fa telephone na friend say obetimi ahwe woni mobile phone so e wo Facebook. Ye streaming live e wo Kantanka TV. Onbo Kantanka TV e wo Facebook. Obenyaye e wo show yi si enye menko na mo hanom say ye wo doctor ni a onim haban mamu enim abrofu numu e nso wo hase a obaba bua show yi ama akoso. Ye na ye ba be ka UTI ho asem. UTI ye yare a eha ye efa ye njonso akwa mebia ye jonso e de fa no e ho asem na ye ba be ka yare a etimi ha ye e wo honom na ansa na ye be wure mu no ye be kwa akogye nkrato aba me a me di show yi bro ye frɛ me Akosua Nyamewaa obetimi afrɛ me obesima ye koton ade abasisia
Bra Nyankopon bo ni wiase no wotena ase din hunu se niam wo bo ye nyina ye na adebɔ nto aso ba akɔ de hye nipa nsa ne awo ene se obi bɛwo ba wiase na kola na didem obi nso so eba wiase ansa na wabenya efa akwanhyia mu enam saa yo so ma Kantanka television edi dwumadie sonko kredi eda so ne makosem ebrewo na dwumadie so ena obohu obi a ofuru kube ekote ebegyina kwan ho eton saa nso na obi a nani afira na woye wo eye eho bibia obohu obi otete ahahai ene de wono nso so eye samna wo mu nyina ani afira na yasan so ne atitiriw atwetwe nkomo afampre wanyi nsen awareja ye hu nsunsanso ene nkwada a ye de omokọ enkwaso ne be mu ahunu se abrabo na wo bọ no achia nso emu.
Do you want to enroll your ward in a school that has keen interest in academic excellence and sound religious upbringing? Then Apostle Safo School of Arts and Sciences is the place. Apostle Safo School of Arts and Sciences, Great Asas, offers general arts, business, home economics, visual arts, general science and technical courses in auto mechanics and applied electricity. Great Asas has well-equipped laboratories for all the science-related courses, an ICT laboratory, and a well-stocked library. Excellent boarding facilities are available for both boys and girls with adequate security measures to ensure your ward's safety. Students also have the privilege to go to Apostle Safo Suaye at Gomu Ampota for practical lessons with the proprietor, Apostle Dr. Engineer Kwabena Safo, for 1 month during the long vacation. We also have a school bus that picks your ward from home to school and back home. Great Asas has a cadet corps, a choir, drama and debating club to harness the hidden talents in your ward. Locate Apostle Safo School of Arts and Sciences at Awoshila Stop, Accra, Ghana. Great Asas.
Yeah, that was a sewenya abutra atwen am yakoton ade about that social Kantanka TV dia na ye SIMA health show mre na eduse UTI ye kokrom kofa Ghana for adwentwe nyina fa ho ye nkone nkwohwe ne Ghana for adwen fa UTI ansa na me introduce me guest no amamo
Efienchua imagine share wo UTI when it say you say you're free Johnson yare so a bit free baby I giant nine and I Johnson when we go in public as nipana na say a fat young as to how we are going to protect ourselves because we are students. Me try say we are Osieni and I say we uko jomo tonwa so far as winning say baby I want enye wo fie so wunya say ehwo enye needs to say wo fie no you have to get something to protect yourself nti e bia uko school na uko junsa you have to get some wipes because they say ayenya nyoma emade paper o ma say at so say o ma junso ewi nti me imagine trend says anyo man to betumi aboy
your family Richard UTI yare no ase Ghana ha aye suban say obi yare a onko check up yare I say unlike HIV and AIDS yenim say see net e deadly inti ye bo hu dawru ni atefan bia ye de hwe enkrofo no sans na yare we no so etie but because enye ade a enkrofo dwe hu bebre ninti no I say ye yani you see enkrofo bebre ho omo yare sa yare ni bi but un hye de hu because say obi ewu bi na ne benya enam nhia onso benya no me tu say bu so na yebu ye ni aguso to me there anka aban no ebo futuo bi to na ye de hwe saa yare no so a anka ebe
UTI yare no say Ghana say ade a common I say on say nti to man me manya how but onso bo oni ni hu nim de bia nti bon say yare ne bakwa na ehihye no sa onko hospital ponko check up bon say na yare na be kese etinka aban no be create some awareness bi ato e dia etichi amanfo about UTI na anka beboa
ayo we ne Ghana for adwentre e fa UTI ho na ene wo studio ho say Dr. Ohene say a friend on the nickname ye Dr. OKS. Under normal circumstances, he's supposed to be my boss, but today I'm privileged enough to have him here as my guest, and I am his host. It's another boss and nurse and doctor, and he's my guest on the show today. And then Wakwadariwo Habai, he's a researcher into plant medicine, and then also he's a young CEO of OKS Medical Consult. Dr. OKS, you are welcome once again.
That's a miniaba.
Now, you come now, you have UTI. Doctor, UTI area being.
Miniaba, you can see UTI. UTI is a dinikono, a urinary tract infection. Now, urinary tract infection, Arabia, ya fa nipedia ana honamna. Honama kwa she bibia ya junso free. Ti ya wa sabo ya kidney. Eba edeba odwunso twa eya bladder na draw ben na da odwunso twa mo pie no eya urethra sa system ni na ye fe ni urinary system se wonya infection bi a affect sa system we ni na ye fe ni se wonya urinary tract infection na urinary tract infection ye yare bi na se dwunso mu yare a no kreni edini penya pa wo hwe nyama hodo e de nkrofo ba hospital a UTI no eye one of the commonest actually in mema any imani na me toa me kasa so don say ye fa oba bia in about 50% and 50% of ema we wiase ni na o fa o mabrabo e free time ye wo o mkosi so be free wiase o mu 50% ni na enya eye UTI da na yare ampempi no in enim say etaachi enya ema ese mbema yeto aye nkomodi isi no meto mebo ase achechire mo ma yate ase die ntia eden etisa
you're not UTI no be emergency say na wo kan na say my next question we ya no say e chema ese mbema na baby say e fa no long term now me discover UTI no in a year and as annually how many people come reporting for the UTI
worldwide there we have the percentage around 8.3 million people report on UTI the whole world data according to WHO, a World Health Organization. Now, out of that 8.3 million, 1 million of them are hospitalized. Yes, a G omo eto a year hospital
because of UTI
treatment because of UTI.
Wow.
A be to me developing core complications a who do a ha nipano. Na the thing say sa yare we Arabia in pempi no obi wo ha won ho enso yare no enshow insentrani bia anti no onhu obi so ha onte sa UTI ne crowd anti obi oba hospital crana o diagnosing of UTI na kasi wenya junso mu yare a na eye no wanwan nanso yare a very very common oba OPD mewa first 3 conditions I record UTI is part of them.
Now UTI no wait me am yare ni bidin a it me affect because UTI no kind of like a broad name. Okay. Under it,
yeah. So under UTI, we look at a free kidney hole if we back pyelonephritis. A no kidney hole side. A bar down, a bar or bladder no, and afraid no cystitis. Yes, when your bladder infection and now or junso channel when your infection womb and your friend cystitis.
Cystitis.
Exactly. Cyst a bladder na itis and say a crew. Exactly. Near war urethritis. A year drobena a da a year or junso charm we pee or bema musa your bema and or baso sa drobena da or junso charm we pee or say sell your bar sa or a chi also a friend urethritis. See along a faster tract no honina edibe pee or see baby a junso a pee fino sa tracting any muno bebia infection be bebia e woni di sin am pyelonephritis, your cystitis, your urethritis. It based on pattern ubenya infection no nya ka se wenya sa urinary tract infection be. One of the commonest is cystitis. Impempi no obeba no oti yaw ewo nase. Exactly. Ebisu wo nase meka nase a yefunu na flu ma se ho pe. Mo nse o ka che oba o ka che doctor me ti yaw wo ho. Ebisu ba mo nse omo ka ma oti se odwonso ntentem. Time bia o ho a o nse na brabo mu no enye sa na the frequency of urination just kwan of aso dwonso no ayeden asesa. Good. And na eba sa so ebi ti yaw so odwonso a ti yaw e wo nase. Obisu ho a odwonso a ohun se nase ehihye no ebisu dwonso omo aka hye o se dwonso no e wo nka dwonso so beba no na ebisu aye cloudy se ne enim no aye kusu no ya sa nyama ahodo senchani ahodo we ni na se patient eba hospital na all present and now say all cast ansem we kire o say ye ne hawa e just a patient no enya eye dwonso mu yare eye UTI aye di ho nkomo yi.
So far no awareness no how is it nkofo bebre ho no mo ya aware of UTI yare, but from what you are saying, you know, me fa layman we na bi mo free say onya white and na say UTI, gonorrhea, UTI. Is that correct?
No, so that's not correct. The mechanism say white another form of infection echi ema ewo omase ene ye friend no candidiasis. Good. Sa white no whole presentation different. And senior o can say ebi ewo discharge, gonorrhea, and also it's more of a sexually transmitted infection. Just diarrhea yenya ewo oba any bema inkita hodie mu. What am I say? But say ba diarrhea ye di hu nkomo yi a UTI no. Emo a edeba no echi o droben na eda o sa o junso twa blood anum edipie. Whilst the oka want say gonorrhea any candidiasis no eno enche sa sabo yes o sabo ne wo junso twa ne wo droben no what is what I say and na gonorrhea no so beba with different symptoms and ansentweni ahodo na edinam ebi ye bon so odi nso fin efri nipako na se eba ne bema no mu ana oba no ne ase eba ebi ye yellowish ewonka hu se odwonso a oti se na hye ehye no ti enu ye more in line with gonorrhea no but eba UTI na enu so symptoms na na essentially ni bi any gonorrhea ni bo nse nso the source of the infection is baby ayare ni free no sonko free from baby a gonorrhea no so din ye den free what so what ma say ti ye describe UTI no the mpese me viewers adwen Akosua ne nipa bia wo kidney ana osabo no wo so ha na droben bi demu a de be pie wase bebi a ojunso twa no eda no ansa na jonso ne pie ti sa system no ho enkomo na enne ye di
ayo na chese wa wo free say gonorrhea ne white ho asem ne ka wa say ne no ye another topic on its own. Because maybe I saw no people were confused say UTI and case when you UTI and not just when you white and as when you gonorrhea any on or either so you draw and say but the best part is say you have to go to the hospital, you need to be checked and when we say when you UTI send a doc doc you can't a man in mema fa say a man nya sen e mema e ba ne say na man nya sen mema. Okay,
you say offer oba ridie sene nyame sifa nwen no na ye wo junso twa blood na meka ho asem no e free sa junso twa no epie wase bebi a junso a ho se junso no pie free no ne tintin ye 4 centimeters just say me de mensa example a ne tintin ye ni na etisei fa se ofa obema so de a ne die no enam ne bema numu a ansa na be pie wo ne bema na no enti enumu wa
esema no
good na aboa na emana mo na ede sa UTI yi bayi no omufa oba na se na omafro ti ohwe oba ase a droben no ketekete se 4 centimeters a onye wura oba na se no enche no wedru wodun so twa no
Oh, okay.
na che say wa cause sa infection and all the sa yare na yeden abrel enti impempi no sa anatomical here kasi anatomical structure and anatomical nature of emma ase keke po emma etainya eye UTI.
Not just say the way the structure is in sending
Yes.
they are prone to
Sapepe.
getting it faster.
Sapepe.
Is it transmittable? Like can
to, from as in say
for
sex
obi beti me dia mo obi.
Yeah, the thing say you will back be a friend honeymoon cystitis say e ba say ofa omo amaware a enche
No, because you doing your friend is saying.
honeymoon cystitis. Just say ni di ne ko no, so mu ko honeymoon no. Omo eslutia ma enche bo na oba na eden enya sign infection no. And
Okay.
When we say a sign the nature of obana sininte no, adi say e ba say wan hwe na see here anytime there's any sexual activity ebema sperms egugugu wase say ebia wako wogya onan wan hwe wase yie nyama bia ekoso wase ho bia ankoso yie bia no ema saa moa no eba wase ho na say omba wase wa esan say kwanya obefa so de ewura odwunso twa no mu no eyiti anti no enche na aboa na duru ho. What am I say? Good. Inti ubenya from these activities here, but enya yarea because sexually transmitted. What am I say? Because yarea only obema da na when you free obema ni ho direct there be.
Oh, okay.
Emo na ede yarea ne ba no ebi free, baby a oja o nan free. Ti omutumi free ohwe kwan eda baby a oja o nan free ene wase baby a ojo fa na eye eno so yetia. Good. Se wan hwe wase yi a ti na bribia na ye kasa se o pepa wase a enya de se o pepa wase efi wechi eba wanim because yes ape o peki eye infectious microorganism na mo na de yare ne ba no o pia omo aba wo droben na no ti enche na wa ye den we rem na mama o den infection ti ma bebre na ye tu omofo efa personal hygiene ho because sa personal or perineal hygiene wase ho hwe no ehun hia ebo ho ban free saa yare a yedi hu komo yi
Ehun hia na chese wo se obo ho ban free saa yare. Doctor can say your kobai bia me hia demonstration kakra no se ne ema yesi paper ye to no. O se ye paper free ye nim ko ye chi. Se ye paper free ye chi ba yi ni. Mema na ye demonstration ama ye se obetimi ayen kwanda. Na asa ne beto se be kwa kofa ye feature of the day aba. Ye nkwohwe after that, you have treatment in one semutina, and Cobia, cause one effort for Adolfo, no one can when I in Siade and for your pomo de Honsem.
My doctor said I have a UTI.
Really? I am sorry to hear that. Are you having any urinary symptoms?
Like what, doctor? Sure.
Such symptoms would include urinary frequency, urgency, burning with urination and perhaps even blood in the urine.
I did not have any of those symptoms. Yet my doctor told me that I had a UTI and that I must take these antibiotics or I may get very sick.
I see. Let's explore this topic further. How was the urine specimen collected?
Let me think. Now I remember. I voided into the cup directly. Why is this important, Dr. Sure?
Collection technique is extremely important. Improper technique can result in a contaminated urine specimen.
What does that mean?
It means that the test result may not be accurate and that a Tuesday urinary tract infection may not be present.
What is a urinary tract infection, Dr. Sure?
A true urinary tract infection means that bacteria are present in the urinary system and that these bacteria are producing inflammation and a disease state.
But my urine culture was positive. Does this not mean I had a UTI?
Maybe or maybe not. The answer to this question depends on the quality of the urine specimen, the collection technique, the urine analysis results, and your symptoms.
So what do we do now, Dr. Sure?
We get another urine specimen from you now by a clean catchment stream collection technique.
What is that?
This technique allows us to get a urine specimen that is not contaminated by bacteria that is normal present in the genital tract.
How is it done?
Wipe the outside of the urethra with the towelette, then pee into the toilet. Then, bring the specimen cup under the urine stream as you are voiding.
What is this specimen shows an infection?
then it probably, though not definitely, means you have a UTI.
Not definitely. What else can be done to definitively determine whether or not my urine is infected?
Only a catheterized specimen can do this.
What is a catheterized specimen?
That is when I get the urine directly from the bladder with a catheter.
Is it painful?
Number.
Wow, Dr. Sure, evaluation and management of urinary tract infections can be challenging.
Indeed they can. I spent many years studying UTIs and find them challenging to diagnose and treat.
Abodie mu no wonim sɛ onyankopɔn ɛwɔ adom a ɔde dom ɔman bia saa akyɛdeɛ nneɛma ɛboa ma nipa nya ahotɔ ɛwɔ ne daadaa asetena mu nsuo mframa yɛaduane yɛnua kwaye enhahama ɛne nnuro ahodoɔ mpo yɛamammerɛ ɛne yɛamanneɛ saa nneɛma nneɛma a nyankopɔn de bɔ ɔman bia sɛdeɛ mbɛma emu nipa no anya ahotɔ enti na Kantanka television ahyehyɛ dwumadie sonko a yɛato no din sɛ yɛdiem ɛwɔ yɛdiem dwumadie so no na yɛkɔ Ghana mmea nyinaa ne yɛkɔ akɔfa nneɛma ahodoɔ a onyankopɔn de adom yɛn ɛne mfasoɔ a yɛnya no wɔ so saa nso ne yɛbɛhwɛ ahobammɔ sonko a yɛde bɛba saa nneɛma yi yɛtumi ahwɛ so ye ɛde yɛgya hɔ ɛde ama nkyirima sɛ meka yɛdiem a na wagye so sɛ papapaa yɛdiem papapaa
Made in Ghana, yediem. O me nyandi yama. Yediem made in Ghana. Yediem made in Ghana.
Meda asese ugusu ayeshe Kantanka TV. Se ugusu hwede yenja ohoye. Yen WhatsApp number any texting number, you can get interactive with us. Yenja wa wo fie e no no ye 0243333500. Women free texting and as wa WhatsApp no fa WhatsApp no fa hon you can comment fa wa join three and as won sim misi bia fa ho. Yenya wo fie be ka me ho ha ne nyina yen fancy misa no en hyehyɛ so ha se e be ye nije sem nya na ye sua ade ewum. Doctor, on the feature of the day na ye hwe no na nipa by a bema na ka test bi ho asem test no ka so betimi atwetwe mu kakra twen
yo senior mi di kan kai no ofa eye dwunso mu yare UTI da e okwan hodo bebre a nipa enya no na ansa na obe confirm ana obe sisupi se obi enya saa dwunso mu yare no your test be a friend urinalysis.
Urinalysis.
Exactly. That's urine analysis. Just say, oh, to boas ya hwehwe Johnson no mu say, bia ube hu niam ahodo bi e kire say o patient no wonya UTI no ana wonya ye. Na ehun emra ne say say o patient no ema o Johnson. Na sa Johnson no de be ma no, wo wan ma no eye container bia o de Johnson ye den ebegum. Ti o de ma na otuni fo say your friend be midstream urine. They say, oh, Johnson ne be di kan aba no, and say oso eno.
Okay.
Emom infin die no, and say wedding oso. Na mpo no answer no be Johnson, and say o paper na se.
Okay.
Se ne be ya say e ba say emoani bi ewo na se ho a, on Johnson engum, emma yenko hu yenka say wenya eye UTI ni bi. Pacho what ma say. Ti o paper wa se ewie a na o Johnson ne be di kan aba no. And so eno infin die no ne fe no midstream urine sample ochi sa Johnson na odi abrel doctor na yetu ye boase aye sa urine analysis no den ewom eno nkoda nchen test ba ko so eboa ye ma ye hu aboa ko a ede yare ne ba no the first test no culture and sensitivity. Yes the ye ne say obekire ama what would say Johnson na ama no what the Johnson ne mana doctor ne the Johnson eko share bibia e friend no ega ana innuane a emoa na ede yare e UTI ne ba no omo pepa ti udi nyade ni gu saa innuane no mu a se owo ni ba ko no Johnson no mu a pon se omo di aduane no omo nyin ewo saa ega ne so ti eba saa pe yete ewo so ne akohwe ewo eye microscope ehu se emmoa na e de UTI ba no ye de omo kogu omo aduane omo pese no bebre enyi wo dwonso no ene kire se ampa wo eye sa dwonso ne bi na no edi between 48 to 72 hours and sana test na ready because say oma ne bre ema no edi sa aduane na ope no na wanyi e wo sa ega ana media ne so na odi enya no pacho what mase tie no de change specifically ema yehu aboako a oye den okose sa yare no aha na nyama ahodo bebre wo ho a efa UTI ho a se unya entiase efa eye one the kind nipa structure se na be che wo oba mu no sa ne urethra na eye short no eye one two obi wo ho a yawo no woni yawo no congenital yawo no na owo problem ana yawo yare bi e dia wo no a affecting the kidney
eye baby
no good ana affecting ne sabo e kidney ana affecting the junso twa eye bladder no enti ema tokro ana meka say bottle bi e be da ne junso twa no ho sa bottle na be da ho no eno timi ma abri bia no sa nkola no mtai nya infection nkola po no ye wo mo a mpempi no between day 1 ekosi 28 days no emema pa na tai nya UTI within that period
and no mo friend queen no
there be any different from queen no
okay
nti emema na tai nya sa UTI no ese ma but right after 28 days no na emma na take over sa ento say oba ndru bra oye bra no sa period no un say onye hu se ni obedi ne huni enti no otai nyanya sa infection no na sa eye drobe na etia no so ka ho na abri bia mo tai nya sa infection no ena ade bia ema jonso ejina ewo wo jonso twa no mu eche bia no eno so the infection ba ti wa hwe omo eye prostate enche no menya UTI because ema jonso no etai ojunso twa no mu ti jonso no tai ojunso twa no mu ne eboa ma emoa na nka ojunso ebe free odrobe no mepie no omo wo mu ana omo enyi omo nyi sa na afei omo stase e cause infection ewo ojunso twa no mu
wo ka your friend says symptoms which is near trust we nya assignment na as me hu some similarities of prostate dear kaka what's the slight difference between prostate and UTI no is there a slight difference
yeah difference yet ni say prostate no se na enia enim no e ya ade a ewo emema ho de di kan de to so mienu bebi a prostate ne hye no e kamia droben na emema adwunso fem no ti se enya kamia sa droben na akoye se wo pipe nsuo fem na odi ebo atoso ti eba sa nsuo no entumi mfemu biom nso pressure so ema pressure e build wo ebo nechi nti wa hwe mo prostate no oba o say bebedwunso a mechima ansa na dwunso na yeden aba because you have to overcome that pressure na prostate no adiaba because of nia na wakemia odroben no ena sankrofo no esan sa pressure ne so nti no odwunso a enye ni na ne ba nti odwunso a enche na dwunso sa ade no na se dwunso na eta ne dwunso twa no se ne so ba
so na ye friend dwunso ya no
exactly enti sankrofo no odwunso se si enche na dwunso je no obedwunso a ote yawo ena odwunso so a se ne ohwe nkola omo odwunso a odwunso ekonechi pa nkofokura to me the competition nkola to me line it up ewo ho na chese ya hwede ne dwunso betimi akochi pa enu ye ka se wo good urine stream
okay
ba obi a wonya prostate esan ka akemia na droben nti no odwunso a dwunso no entimi nkochi odwunso ya na egu ho egu fom ho a ena sa nkrofo no so esan so mutanya infection nti no onya sa frequency de me ka wo UTI mu no infection no de sa de ne bre no odwunso esi na dwunso e de no sa tia wo na ase eye dysuria o sa te sa no mo dwunso wi a prostate for no odwunso wi a bon se na dwunso na sia se den esan so na bebre na so enye mmema e wompem esan sa problem na e wo ho nti
doc we introducing more topic into the topic me director say who share me you be here part 2 of this because we are doc dey kon say I'm getting more interest and then I know some my viewers are also getting more interested in that side. Yenka preventive measures and then the treatment. No, treatment. No, which one would you say best? Should we go for the since we are herbalist and then also you research into plant medicine? Would you say herbal one? No, be saying orthodox nana. I don't want you to be biased, but then we really want to know.
Yeah, see, with my orthodox background, yeah, as a medical practitioner, you may say, share the UTI banner, your commonest one in 80% of cases, your friend E. coli. Yeah, kasi Escherichia coli, E. coli. Sa abuana sa Johnson yare bano or your bacteria.
Okay.
What am I say? Enti say one share who see no nya sa infection we pe. Sa abuano aba o system aye urinary system num. When you aba o system num, as I say ye pe ade bia your friend antibiotics and antibacterial ade a ebekun etia sa bacteria no what am I say na etumi ye den eyi ni free ho nti unya UTI na okofa ebibidro say wo dey treat UTI or bra wo start nya this unya this symptoms here oho no aya na ayehu because one hwe ya really to me develop ya na akọ omogem eno no your friend urosepsis eno dey one hwe ya bekum etai ekun impenifo pa the elderly
UTI can lead to death.
Yes, UTI can lead to that. There are several complications. Wow. UTI can lead to what we call pyelonephritis. A bit more spread alcohol. So what's in the material no. A bit more cause abscess around your kidney. And also bit me ekun. Enti say unya yare ni sana e won be hia say obenya antibiotics a ebekun etia sa moa na omode yare ni bae no.
That is from orthodox side.
From orthodox side. Ti no fa antibiotics are ebekun etia sa E. coli. Ye wo mo hodo bakoso din the Proteus.
Okay.
Bako din the Klebsiella. Za emoe ni na e de sa UTI ne den. Eba.
Enti se wan fa mi edino mo share da na. Mo share na because edino e dodo. The names are very interesting.
Yeah, research. Nti o hwe your research mo a we belong to a class of bacteria from gram negatives. Yes, this our class no omu bebre na etai cause UTI your gram positive so ba omu so wo mudin staph saprophyticus staph epididymis omu so ewo ho your Proteus mirabilis in more way ni na e de sa UTI ni e den eba ti se okofa ebibidro bi se ye research into a wo de ba be kun samuwa we no so they
can grow prone to start with medicine.
Exactly. To be for antibiotics.
Okay.
Tina say obesha to make you to meet you obi na wa sha se efe. O to me face no ayemre. To we hospital e be ye test lo. Obo hu say bibi o my friend parcels indicate about we say a cost be to me call above 30.
Wow. What's the normal average?
It's supposed to be less than 5.
Wow.
Yeah. Need to me call above 30. Na other indicators leukocytes any maybe be hwehwe wo odwunso no mu no obehwe no na eye ni na wo ho ti obi sa na ya admit o na ya set line amawo na ya amawo antibiotics na fa line no dia bre emu anase cause ya mboa enkum san mo na obi wan say sepsis say bacteria na nyi wo mogemu ama sesia no okobe bia ti na say or cause the friend no multiple organ damage. Or chi organ bia ana wonama kwa bia omoja tumi ko bia ti yare a imprempren no echiwa as they say the antibiotics no clear mamenka we sometimes we be ba hospital or any symptom bia it's say UTI ana Johnson yare ya de tachi emanti no oba hospital ye test emao say ye urinary urinalysis ye ma and our urine routine exam ye sa examination ma wa ye be ba no obo ha na mo ahwe nya no be hwe na ne dwunso mu report na kire say o UTI eno ye friend no asymptomatic UTI kire say UTI any symptoms and now UTI any sensory
just say nyanda ne ho edi
yes enti koso wo ni ba ko ni wedie mu enso ni ba ko no kra enshow and onya enya sensory ni bia kire say one musa say sani ba ko wan hwe ya obi wan say Akosua the next minute be hwe no ofe na no wan hyehye na sese ye gene to ho na ye ma na duro ti san krofo no ba na ehu enkanka pemfo oba for normal antenatal visit.
Check-up.
Yeah, urinary amount, urine test amount, obehwe no na infection ewom. Infection woma ebe ma antibiotics. Na ye dey treat for there. Until that's the orthodox side. Eba herbal
no. Me who say adverts. Mr. Manya say yes, say will be ejuma, but then the health of Ghanaians are very important. Adverts of course will be on TV so. And I will say afa, and I will say afa, and then tightening medicines are dorsal. Inra ye de chi asesebi ye de ma de chi o ma se ene ne ye de fefa honom ne ade. I wouldn't mention names and the etwegu bebre with TV stations ne ade. What would you say about, since you are a health personnel, no, the Food and Drugs Board has approved say yen show yi and then obi nya symptoms kakra bi na no akọ drugstore ene mami we ne o makeka afra kama, and then on social media we say something is trending even with the garlic e show ma se without knowing whether adina wenyan whether it is this or it is that without any checkup. No masha say more home remedies. Since we are doctor ne die, Mr. Can be trained for.
Me da se pa the me pese me viewers be hu ne say didi kan enye say herbal medicine enye Apostle Akosua Safo na a training right from about 6 years ago. I started research into herbal medicine. You draw FDA approving in a very good herbal medicines. Ejuma. You get what I'm saying? Now, ebia ne dabre. Oshe eye ebibrem hana. Yenye research bebre yen draw ye use mu. Ti obia kan bibi fra na wa sha se ye den. Eton. Indro na ye de hye yase no. Little do nkobu ha onte eye redie na se. Oko emma asi hona or are very prone to several infections because a large surface area a one pH the natural medium and a natural state nyame ebo no ade bia o de hye ho bia no distort sa natural state na ebo ho ban efiri yare ahodo no to go wa problem no cause sa inhaban bi ahye nase enche na yare fofo de no wa eden agemu on processes are in her binding way no crowd on tea. Quite fast to processing herbal products. On tias here, anti buying no so go through the right processes. Dosing another issue because most people hear herbal medicine on what only the exact dosage are safe
for the one
good. Anti a banisa o de obia ye keke e de ahye wase no. Wan hwe ya na upra Inti every one condition na call the other. Na to aso sa
at the end of the night chronic
good. The infections ahodo bebre etumi ba ebit etumi fro wase etumi ma odi friend of PID. A pelvic inflammatory disease. What am I say? Inti the American afa sa indu na edishi asin say you have to be very careful. Understand tidie edrona ofa no ase herbal medicine is good because answer na abrofo di edro abrofo dro herba no na herbal medicine was already in existence but the issue is ehwehwemu aye o herbal medicine emu no eno na enko ekyire good enti bisa won say sikas dodo say na aban dia share research into plant medicine mu it's very interesting what am I say enti say onya eye plant munti ase a obehu say artemisinin annual eye artesunate ya fa for malaria ye plant good plant source so some no way ni na be bring our plant source which has yen research into it very well by yen exact dosing clinical trials why toxicity studies very well and you know me for a drone as a medical practitioner no me ti a drone me fanase and herbal drug no answer na mefa no e say me ti ase yie na me hu say eye de say eye den eye no anti herbal medicine is good but you have to be very careful.
First aid is good but you have to be very careful. You can see a doctor get a bit personal with has because or your researcher or your medical officer and so upon time man can one kind he's a CEO of OKS Medical Consult. Now you can now say before I realize you need to go to the hospital, you need to go through thorough checkup. I will say doctor prescribe doctor friend saying antibiotics at the mouth. Whatever is trending on social media, adverts or more me sabi obi dey penny sika, but then at the end of the day no, is it worth it? Is it helping Ghanaians, especially man? Sabi you know obi bekwa akoda nipa ni beji ewie wo bechi wase kama ma nipa ade bechi no na wo yare na wo da ho near the IVs besusu ne they go through the best procedure to cure yourself, and then the vagina no, excuse me, say wase ho no, it has a natural pH, it tightens itself as time goes on, and no ankasa che no ho nti tightening formulas ne ade no yes stremo mama yintwa so kakra minua man yenkoje nkrato we yesima health show wunya wo baby a age Kantanka TV ye ba sisia.
Onipa how ene ne da achenti e na abribia wo sori pre ehwehwe na ahoto ne nso e ma prekope enkukuhwe ase ene wo how bebre ene wo mu wenti e na Kantanka TV ya hwehwe dwumadie foforo kra ya to din se edwaso nsem wo dwaso nsem dwumadie so ye baba pne adwadifo ne abusa wo mo how ene wo mama ne wo mo efa mu na empo se edaw bi tai akira a wo de pre ahwehwe won da achen ahoto eno ti hia wo nua ba ama adwobi e wo Kantanka TV ne afa edwaso nsem enfam bro.
Medase so guso ayehwe Kantanka TV eye ni gisem eye apomode ho nsem na ye ka ho asem no ye gi eni nya ne yesu ade afem ye ka ni nya no memfa nto utrim keke Bible se ma ye nya asem ni tiefo ne yenko ye asem ne yefo fa ka wa brabo ho na ebebo wote nkwam nko ade na it is your sole responsibility to be charge of your health enu nti na SIMA health show ye te hanom a ye de apomode ho nsem ebrary telephone number no still aye 024 3333 500 ye chain menfre ye chain or text message wa WhatsApp no so fafa so ama for the mo questions ba enche bia me ne doctor ye de be hihye so doctor patienko preventive measures no
say obehwe a me kasa about UTI me kasa fa ade a de ba no ba ko a me pese me viewers be very careful about ye kasi me kan stasis ya say bibi etai fa ko enti ohwe omo BPH and prostate enlargement na bibi akamia omodro ben ntine ma Johnson no etai omo Johnson twa no Johnson no setai mu no na emmoa no ahyase a omo yeden omo nyin. One key thing eboa pa with prevention adequate intake of fluids. Se obenum nsuo obetai anum nsuo na se onum nsuo no obi bisa say nsuo dodo saying na memfa in a day. So 3 liters to 3.5 liters. Ofa nsuo kese 1.5 liters no ba ko a eno saa mienu 3 liters. Ti da kru bia o ka wan nom kra na kese so tumi nom saa dodo no. Ne papa mu no ka osori anope bia utumi enom warm water. Warm water. Warm, good.
Not hot water.
Not hot water, warm. Ti onum was our warm water na eboa is a cleansing mechanism. Ti ahomachi be 5 more sorry no. No anum e dey prepare o bowel no. E ma otumi nya good bowel habit. So to me ja ona yie. Eno nso eboa ma nsuo tumi kọ oridi enum yie. Ti nsuo kọ oridi enum yie so a eboa ma o sa wana o kidney no enya nsuo the processing waste substances necessary o junso ba no tinsi o ne dose no na eyi sa waste no gu nti omo tai no munso bebre no abribia omo sa junso bebre nti obedwunso na junso no ye amber ni obeka say clear ana obeka say white clear kra enye yellowish what am I say ti say o junso ye yellow ana ye tuma eno che say you are not taking in adequate amount of fluids. Ti onum bebre nko ade ese se odwunso a etumi clear with time ti yellow na clear eno ye one habit ti insuo num de abribia no ese se ade a me viewers no mbehwe na omo hye ne so ema me the etoso mienu eye vitamin C. Research actually say vitamin C yenya ewo ye fruit mu. Because I'm a promoter a natural medicine campaigner intino. I may prefer organic substances obenya vitamin C no efrim.
Full vitamin C.
Yes. Than say all to talk tablets or no tablets vitamin C because organic form no healthier and it syncs with the body better.
Okay.
Into onum anka grapes. Sa fruits and vegetables it be breya now vitamin C. Eboa e boost the immune system. Eboa so e prevent acidic nature and e prevent bacteria na make an wasem no from thriving. Enti eboa e bon ho ban e free UTI no ho. The vitamin C a very good make I say micronutrient eboa e prevent UTI. Another well-known product and make I say natural substance a cranberry.
Cranberry juice.
Yeah. So cranberry juice ni o ma ye bia is o ma ndoko de bi enye no asem na make pe unsweetened cranberry de enye de nyonyonyo no. Na wa hwa wiase no ade bia e de bebre no e wo ne nsusan so. Ti hwe cranberry ni a research actually say aboa na e de sa UTI ne ba no commonest e E. coli. Sa E. coli o bibi e wo ne ho a ye fe ne fimbri. Sa fimbri no eno o de tare wo drobenum na aboa na tumi afa sa drobenum anante afemu akopie odunso twanum. Research amayati ase say cranberry no eboa ema e prevent sa fimbri no from attaching to your urethral or your mucosal lining wo bladder num and urethra num nti aboa no ntumi entare na wanante akọ what am I say it offer sa cranberry juice naturally no o bon ho ban every UTI ho ti wa hwe omo ye national medicine campaigners in bebre na okọ as part of their treatment obeka say take in cranberry juice obeka say fa inomu nso bebre take in vitamin C containing substances nasan making sure say you do a lot of fruits and vegetables. You can fruits and vegetables and you can organic because GMO and bon ho ban. Into a serious alert, GMO foods will not give you what you need.
You
need organic fruits and vegetables.
GMO will not give you the
requisite make I say protection here for a natural body. So you need organic fruits and vegetables. When you draw ahodoa ebebo already no ban ti bibia no eninia eche organic eno na eye the way to go say nyame born no saa so na eboa ready no
say nyame born saa so na eboa ready no enya your comments na ntiesi from Kanishi or since when pains during urination and sana we see you fantastic educative. Please, your show is very educative. Thank you for watching. Coming from Steven from Tema, thank you for also watching. Keep watching it. We have lots and lots of goodies to bring you. And then also, we super say, Johnson tentem, but we quiet check up no nyashe. But still urinating faster.
Okay. Me first one no see Ojonso tia.
They can na ye compliment.
Okay.
But the last
one here Ojonso tentem.
Ojonso tentem we quiet testing but omu hwe.
Good. Until the etini say na me kan kai no. Medical systems of assessing patients. Say obi ba hospital ni assess na thorough. Very extensive. Ye to eboase efa history. Na ofa history na in semfo ahodo okabom research actually says nipa ko no was nyama na osusu say owodunso mu yare. Frequency is one of them. Sa frequency obi wo ho a ono so etai enum nso bebre obeka say o mi de midunso bebre sense menum nso bebre eno wo ho ye wo obi a owo sa frequency no with this urea just odunso a osante a eka ho na eno ama the likelihood of UTI are very, very objective and now very likely. But what am I say? And it's so Ojunso intentem nko na so we test near negative, then it means only urinary tract infection. But what am I say? And say oma eno han bebre na mum no on call the doctor when assess who the entire obi wo ha ne dwonso twa no too sensitive dwonso free o kidney say go mu ano adwonso nti on penifo na omo menya be 15 18 years omo ni na omo dwonso wo keteso not because onya infection but overactive bladder so etumi ma odwonso intentem
overactive bladder and etumi ma odwonso intentem Portia send and okay kan koso aneko hospital no mo hwe and share with ye and then keep drinking the water. Now my bonus for the day, my dear mom when I can UTI one same baby ye call practical segment so baby share near air cost so say obi choke ya there will be ye ede aboa nipa no abra wansa na de na hospital and no na bonus segment I de every morning within a few seconds no ye be atrum ti tobo na show Kantaka TV.
So whenever you're dealing with choking, the first thing that you're supposed to do is when you approach a casualty, first of all, you will see the signs from a distance that the casualty maybe was eating something, then all of a sudden the behavior starts to change. So as a first aider, when you approach, the first thing that you also need to do is ask the casualty whether they are choking, then ask if they need your help. So the first thing also you need to do is encourage the person to cough, because choking can either be a partial or complete obstruction. Then ask the casualty how they're feeling. If it's not yet out, you will go to step number 2 where you give up to 5 back blows. Sometimes the obstruction might come out, but after the 5th back blow and still the obstruction is still in, you will administer abdominal thrust. Up to 5 abdominal thrust. The first one, second one, third, and the obstruction maybe might come out. Then after that, sit the casualty down, reassure the casualty, and you can also give water after the obstruction has already come out. You can give water. Then there are several people that you are not supposed to administer abdominal thrust to them. Then these 3 types of people are who? One is expectant, the other casualty is someone who is obese, and an infant. Those are the 3 types of people you cannot be able to administer the abdominal.
A quick way, not just an any NHS so be choke ya near wo be edi aboa nipa na ansa na na hospital ye hwe na odi brodo na a scene when minim nipa ne bae na obeboa no no coffee or bowa to encourage ni so onkoso bowa na owie no obo ni chi eboa ma bread na aka ni minimum no epie ye ebi ho ha okoso ba ida say obeforce amene force mini ana so ye na epia ni nyina no eye so we bonus for the day aye the ema. Doc, your final words and your final advice on UTI.
Okay, for my final words on UTI, make I say, urinary tract infection area very common. Na it's say common in Tino. Preventive medicine is key. Abribiano, as I say, utai regular checkups. Say, but to me, they be offer a feel munina at least want to me cry twice every 6 months. Do a thorough checkup at least once every 6 months. Na including your urine tester, your best share ehu sayari. Na say base unya symptoms and bo so say be out junso tentem o junso out yaw. If we cry to me junso mojeni na ti o junso out yaw say o junso dewa no one kan one chena junso na yeden aba. Oti say o junso anu ase den ehhehye o. Obi wo so a eba de sa na awati egu no so na ofe. O si mu san century ni ya ese say o ma wonan enti na wokọ o doctor ho na ohwe wo na o ma withdraw. Na preventive medicine side no there say na me boss no taking in adequate fluids so betai anu nsuo eno ye 1 2 vitamin C e benya wo fruits and vegetables. Stressing on organic. Say your organic unya sa inwani no nyeden ewo inwani no musa. and sana mikasa about cranberry juice and also eboa prevent UTI. It's a mechanism. The bitter one, not the sweet one. The bitter one. Enti me viewers ne enhye so say ye no nsuo every time. Say ye exercise. Say ye fat fruits and vegetables goes a long way to prevent UTI. Madam Nina say.
And I also say more fluids, more vitamin C's from the organic source. You pet tablet vitamins, you know. Yes, soluble ones needed to you know. You can get some small lemon, be just put it in your bottled water. You can carry it throughout the whole day. Obit me the one card chedivia to you. Mobanum the whole day is still vitamin C, which is going to help your system. And then Dr. Minyano has a Dr. OKS or a practitioner. And then a researcher into herbal medicine, and then also or a medical officer ewo pantai. But me pantai person doctor, I need to go through normal procedures. We as a doctor, the obesho, but a person who doc one-on-one, you need to call his secretary on 0249 699 809. Or no be book your appointment now when you doc one-on-one. That is OKS Medical Consult. And let's show you, the break Kantanka TV and our share. Why we share movies? Me da say when you are ready share. Cause one share Kantanka TV. Na and then so that's and besides share ewa ha ewa SIMA health show so. Me a me di show you bro. Your friend me Akosua Nyamewaa. Yeah that's it. Yeah di nyame nsu jamo.